The conversation in this particular hour is with Dr. Dennis Miskellah, and he's probably going to tell me if I've said that correctly. It's Dr. Dennis Miskellah. He's the Deputy Secretary General of KMPDU. Daktari, a very good morning and welcome to Radio Generation.
Thank you so much for having me. I appreciate it.
I was just asking Daktari earlier on what medicine he practices, and he said, is that how it said, by the way? What medicine you practice? What kind of doctor are you?
It's okay.
So he has told me that he is a gynecologist. And how long do you have to do your masters to become a gyna?
Yeah, so after you graduate undergraduate, which takes around 6 years, and then you do the 1 year compulsory internship, then you can either go back for your master's immediately or you can go and practice a bit as a GP. So the master's program takes around 4 years. Yeah, sometimes it can take 5 years if you have to do the research and maybe delay on it.
5 years?
Yeah.
So you do your undergrad for how long? 7?
6.
6.
And then internship 1.
Internship 1.
Then master's can take 4 to 5 years.
So basically, your entire adult life, you're just studying.
Yes.
Before you get to practice.
Yeah.
All right, karibu tena sana to Radio Generation. And let's just get right into it. My colleague here is Patricia Waywa. So she's going to be helping us, tackle some of the issues that we would like to talk about today. And it's about the health standoff. What is up? There has been always drama in the health sector for years, year in, year out, with every other government, whether ni wakati wa President Moi, President Kibaki, President Uhuru, sasa tuko na President Ruto. Why is it that this health situation is never ever sorted? Is it because of the understanding from government side? Is it understanding from the health practitioner side? Where is the disconnect?
Yeah, so first of all, thank you so much for having me here. And I want to thank not just Radio Generation, but almost all media houses, because in the recent times you have seen the kind of interest that healthcare has evoked amongst the media and even amongst the people. And I can dare say that health is going to be a very, very critical issue in the coming election. I keep on saying that President Ruto's re-election or failure of is going to be largely attributed to the healthcare agenda, which is so good because for the longest time Kenyans have treated health as a very private thing. You fall sick privately, when you die is a private thing. People just mourn and go home. People never ask questions, why are people dying? Yeah, so it's important that we talk about healthcare. So health has been a problem, and largely after the evolution, because Kenya did a very, very big mistake in devolving healthcare without having to cost that function. I remember that
just go back again. Kenya did a very big mistake by devolving healthcare.
Yeah.
All right.
That was the first mistake that we did as a country, because when we were making our constitution, there are certain functions that were said were too important to be devolved, like security, like education. But then somebody sat back and thought, in their wisdom or lack of it, that devolving healthcare was just a perfect idea.
Yeah.
And when they did that, the mistake also we own as doctors is that when teachers were resisting education being devolved, doctors were busy discussing when does life begin, what is abortion, and all that kind of stuff. And then the carpet was pulled right under our feet. So we found ourselves devolved. But so be it that we were devolved. President Uhuru, when he came in, told the governors that let us not rush to devolve this thing en masse. Why can't we cost? We know that this is the amount of money you'll need to run this program. Then we can start maybe with level 1, 2, 3 and observe what happens.
Which president did this?
It was Uhuru.
Okay.
Who told them that we do piecemeal. You can either do per county, or you can say we start with maybe level 1, 2, 3, then 4, 5, 6, get that. But the governor said no. And it was led by Isaac Ruto, the former governor of Bomet.
Bomet, yes.
He told Uhuru that you are fighting devolution. Give it to us. And Uhuru said, it's okay, you want it, take it. So then they devolved healthcare without the proper structures. And that has bedeviled Kenya since then, because we have 48 different ways, or not even 48, it's 49, because you have national government doing their own thing.
Yeah.
You have 47 governors doing whatever they want, private sector doing whatever they want. So everybody just in this whole mess.
Yeah. The
person who then finally has to pay that price are two people, the poor mwananchi and the poor healthcare workers. Because this healthcare worker, you find yourself in a place where your salary is delayed like for 3 months. As we speak, most counties in Kenya have not even paid July salaries. Some June salaries. You get that?
Yes.
You find a place where they deduct third-party deductions like your loans, the policies for your children, insurance policies, your SACCO contributions. Somebody deducts it from your payslip, you don't get it. But they don't remit it to the place. So you're in CRB, the insurance for your child has lapsed because somebody pocketed the money they deducted from your salary.
Daktari, how much is a doctor? Because we saw the other day interns, I think they're getting what 206k.
Yeah.
Daktari mwingine amekuwa established kama wewe anafaa kupata pesa ngapi?
So the doctors, the interns who earn around 206 in gross, by the time you deduct all those things, you end up around 140,000.
Okay.
Then the next, when you finish internship, you become a GP, you then earn around 250.
Okay.
Yeah.
All right.
In gross. Of course, the taxes will bring it around 150, 160 hapo. Yeah.
Aye. Sasa tena from 250 all 100 just disappears.
You know taxes are taxes. We have to kulipa ushuru ni kujitegemea. So that
that was so sarcastic, but yes.
So averagely that's almost GP. The consultants probably earn around 300k gross. Then by the time they deduct it comes around 180 or 90. So that's what most people earn.
Okay.
But the main challenge has never even about the pay.
Yes.
The main challenge has been that the timing. You know, when I know that every 26th or every 30th I have my money, nitajipanga nayo. But when every day you have to look at the skies like somebody desperately hoping for rain, you unaangalia kwa account kama kitu imeingia, you never know. You cannot plan, you cannot even tell your landlord or landlady when the money is going to come. You can't even tell your kids school when you're going to be paying that rent.
That fees,
so that uncertainty of it all is what really frustrates healthcare workers.
So there's this other issue of apart from delayed salaries, we start here with the council of not council, but they were clinical officers.
Yes.
And one thing that came out also, apart from the funding part of medical health, it's the issue of why am I forgetting this word? He told us the number of patients that doctors have got to treat on a daily basis. So I don't know if you're probably facing the same issues as clinical officers, because he was saying that per day they're supposed to see at the very most 35 patients before advancing them to either a referral or whatever. So madaktari, sijui your quota per day, how many patients are you supposed to see and how many are you currently seeing?
So WHO says that a doctor should cover 1,000 people in the population, not patients.
Okay.
That for every 1,000 people there should be a doctor.
Okay.
Yeah, because they're all potential patients. Currently one doctor is attached to around 17,000 Kenyans, so we are almost 17 times shorter. And sometimes when we say these figures, you might just think that they're just numbers. People don't understand what it means. What it means is that today there's a woman who was woken up somewhere in Kawangware with a child with fever the whole night. She probably is a mama fua here in Kilimani. Yeah? And she wakes up wondering that, do I go and do my fua business, then come back and take this baby to the hospital? Or do I take this baby to Kenyatta or Mbagathi, where they'll queue the whole day? She goes to the hospital and queues the whole day. The other two children will be sleeping hungry. She goes to do the fua business first. She comes back and finds the baby dead. That is what this shortage means. Means that you're going to be queuing the whole day to see one doctor, all of you in the casualty somewhere in some of these hospitals. And that is what then makes sometimes patients choose to go to these local clinics in the estates. Not because they are so rich that they can afford the private healthcare, but because at this pale, they'll be going in and out within maybe 30 minutes to 1 hour. Sadly, in those local private hospitals, there's something called poor private clinics, where it's private, yes, by the name. So somebody will think it's a very high-end private hospital, but no, it's just some nurse or CEO or whoever, or just some quack has seen a need and opened. So this baby will go there, will be told that you have unseen malaria. Then they'll put them on anti-malarials. Then after a week later, the baby will be dying from meningitis. You get that? Because the person whom they saw was not qualified, but they're trying to fill a gap that the public health sector has failed in this country. 56 to 60% of Kenyans are seen in private hospitals. And there are two types of private hospitals.
Yes.
There is the high-end hospital where you go to and you are sure that you have reached the place, we know them. Then there's the private for poor, where it's just a convenience. And then they found that the drugs are probably there and the lab is working.
Consultation ni mia.
Unaelewa? Yeah. That is what happens. Yes. So as a country, we must first of all, as a government, decide that is healthcare a social responsibility of a government. And as such, then do we fund it properly? with the taxes. See the way education gets 600 billion for education. The police get their billions and they recruit every year. How comes that when it comes to healthcare, we are being told that Kenyans must pay SHA to get the healthcare after paying taxes? Why are we waiting for Mzungu, USAID, Trump to give us their taxpayer money to fund our healthcare?
And we shall get to SHA and we shall also get to USAID in a minute. I want us to go back to that point where we were talking about devolution. Had we not devolved health? Because even before devolution, bado tulikuanga na issues in the health sector. So had we not devolved it, what kind of picture are we looking at right now? Are we saying that we'd be having more doctors serving patients? Are we saying that we'd be having even better pay coming on time? Is that what we're saying?
What we are saying is that before devolution, there were challenges. But remember that before devolution, we had like only 2 or 3 doctors strikes in this country. After devolution, we have had over 100 strikes. Even right now, we have a strike that's getting to day 73 in Kiambu County. We just finished the strike in Kwale. There's another strike that is maturing in MTRH. So,
did you just call it maturing?
Yes, you give it 14 days and then it matures. What happens is that healthcare is a very, very complex thing. We have 49 cadres in healthcare, from the doctor to the nurse, the clinician, to the lab officers, to nutritionists, physiotherapy. There are so many, and there's so many moving parts. Healthcare is the only service or product where end to end it is human beings, from the hospital owner or managers to the doctors to the patient to the relatives. You only deal with the human beings from end to end. So you must really understand what you are getting into. So you have these governors coming in. I know they come in every 5 years. At this national, you can only say that a president can take 2 terms. But in counties, governors only have 5 years. These 5 years, this guy wants to loot. He wants to get money for campaigning. He wants to fight for this election. He knows he might not be coming back. So he has all these supporters and villagers who campaigned for him. So they come in and the only intention is, we have 5 years to
loot.
Yes, kujijenga. Unaelewa? And this healthcare, you get somebody. I have no problem when a governor appoints a retired teacher or a retired campaigner to be a chief officer or a board chairman in the county, and this person wants to supervise somebody who went to school for 15 years. I don't mean that we're any special as doctors, but
you're very special by the way.
You know, this airplane guy who has been in school for 15 years is now a consultant. Then you want me to come to you, some Form 4 dropout, to you are interviewing me for a job or supervising me for my work. It's like literally devolving universities. Then you want the professors to be supervised by retired villagers. So they never understand. In fact, the biggest challenge I've had as a union leader, the biggest challenge is that you go telling them that you need to promote this doctor. Then they tell you that this guy is young, he's 28. Why should he be earning 300,000 when I'm earning 150? But he's a doctor and you are not. Get that? So they refuse to do. You said to tell them that the salaries have delayed or you are not repaid my loan. They didn't know. You're a doctor, you are rich. Why are you complaining?
Daktari niko na swali. When like you practice in Embu, right?
Yes.
And I'm sure you usually have a sit down probably with the governor or even the CEC in charge of health. When you sit with these executives, what conversations do you usually have? Because I'm feeling like it's either they don't listen or they listen but they just don't care.
You know, the challenge in Kenya is that we are very, very heartless people, especially people whom we elect. Kenyans like their leaders corrupt and they like their leaders rich. So then somebody has to look for that money. So you end up with people who don't care. Somebody is a governor in charge of healthcare in a county. When they fall sick, they come to Nairobi or go abroad. I'm like, it's like a parent who makes breakfast for his children, then he goes and eats in the hotel. You don't believe in whatever you are cooking yourself for your family. So you talk to them, you tell them that patients are suffering, people are suffering, but they are detached. They are detached because they are looking for, the first term governors are looking for money to vie again. The second term governors are looking for monies to use to probably bribe and become CSS in the future, or senators, or MPs. So nobody thinks about Mwananchi. You get that? In fact, the only people left fighting for Mwananchi are the unions. On a normal day, unions should fight for their own members. But many a times we find ourselves going for strike for drugs, going to strike for equipment, going to strike for employment of more healthcare workers. Because the leadership has failed. In WHO, they say the pillars of healthcare. They say that you need to build hospitals, the infrastructure, and stock them up and put equipment. We are doing largely well with that because, Kenya tenders. So they get money from building those dispensaries. You now have in Kiambu, they built 32 more hospitals. And doctors are on strike for 72 days. You get that? But for obvious reasons. Yeah? Then you have the managed equipment scheme, which was under who they brought in equipment and all that from abroad. Of course, it failed miserably, but it was there. Now they're launching today the National Equipment Scheme, where they are bringing people to business people to put equipment in hospitals, then they are paid from SHA. So largely we are good with the infrastructure. After that, you have to hire healthcare workers into those facilities.
Did you just say we are having someone bringing equipment to hospitals?
Yeah, the new National Equipment Management Scheme, and not previously it was that government leased equipment for 7 years from manufacturers like General Electric and all that. Yeah, it didn't work because they brought the machines, they charged the amount, but there are no people to operate those machines. But government paid almost 64 billion for it. It was a scandal for another day. But now the William Ruto government has come with an idea which I believe is better, where they say that when you are coming as a businessman, you are installing this CT scan. You come, you operate it yourself, and you charge what you have agreed on. Then out of you giving the service, you get paid from that service the patient was charged. Okay. So it has to be working.
All right. So you're saying there's a new system that is better than what we had previously.
Yes.
And it is this government that has introduced it.
Okay. So that it is, as a supplier of the equipment, you run it, manage it, then you'll be paid. If you don't work on it, you won't be paid. Yeah. So on that part of infrastructure, you are doing very well. Then there's the second bit that you have to hire healthcare workers, because we have a serious shortage of healthcare workers. Can you believe we have like 100 oncologists in this country, seeing 54 million Kenyans with 45,000 plus cancer diagnosis positively gotten, with 9 women dying every day from cervical cancer? Yeah, we only have 100 oncologists in this country. But you know why they won't train or hire more? Because their salary, how will they benefit? So they don't see the need. So they don't handle the HR challenges. The other bit is that after you have done that, you have to bring drugs. There are new changes that have been put in KEMSA, yeah, on how to supply the drugs and all that. Still perfectly well with us. The biggest challenge,
but we still have drugs that are expiring in hospitals. Yeah.
Yes, it expires because counties have refused to pay KEMSA. KEMSA cannot supply you if you still owe them money.
So we'd rather billions of drugs worth of drugs expire.
Of course, we know the motivation in this country. There's something called push or pull demand of drugs. Pull means that if I'm in Kisumu and there's malaria, I'll tell KEMSA, supply me malaria drugs. But push means that somebody sits somewhere and tenders for malaria drugs. Then they say, where can you take them? Then you take malaria drugs to Meru, where there's no malaria. And then they end up expiring. Or buy more than is needed, and then they expire in the stores.
Is this one of those other scandals that we need to have a conversation for another day?
Healthcare is one big mess anyway. But more importantly, I want to say that when you are done with all this, you have to finance it. You have to finance the building, the drugs, paying the workers. We are going to talk about healthcare financing under SHA. But WHO says that after you put all these 4 pillars, you tie it in a neat bundle under leadership and governance. That is what is killing Kenya. Leadership and governance, where our governance system of devolving healthcare has failed. And we have to be honest. I know that we have tried pushing for the Health Services Commission. We have tried pushing for the decentralization of the curative bit of the medicine. We say that level 5, 6 or 4, 5, 6, where people need to be saved from death, we run it nationally under one policy guideline. You get that? Then the preventive medicine, dispensaries, chanjo, deworming and all that, to achieve counties. See, you have left for them ECDs.
Yes.
And they're doing a good job with ECDs.
Sure.
If you gave them universities and high schools, they'd run them down. So telling them to run level 5 hospitals, ICUs, renal centers, is a big mistake. Let them deworm children and teach them how to wash hands.
I'm so sorry, I'm laughing. But
so I've always been asking myself, is there a part of that health sector that has not been devolved?
Yes, the level 6 hospitals, the KNH, MTRH, KUTTRH, Madari, get that? They have not been devolved. Do you know why? Because that is the only saving grace. Right now, everybody who falls sick in this country, if you have cancer or these serious illnesses, your only saving grace is going to a level 6 hospital. You go to any other place, you are going to be in trouble. But how many? Now you see the government right now under President William Ruto is now gifting people with the level 6 hospitals. Why is it a gift? Because the level 5s in the counties have failed. So everybody in JTRH, Russia and Kisumu, they'll be given a level 6, they're clapping. Bungoma wamepewa moja, they're clapping. Meru wamepewa moja, they're clapping. Because we all know that the level 5s, the counties have failed.
So hapo president amekuwa mjanja. If he went to every county and just decided to, do I call it steal it from the county and say, now he goes to Kitui and says, this Kitui whatever hospital I've now elevated to level 6. Hapo atakuwa amesaidia watu.
Yeah, you know, the governors, when they were told that healthcare was involved, then they thought they found a pot of gold. You know, then they go to this private hospital and they see the kind of money you pay, and they thought that hospitals are so rich. They didn't know that healthcare is so expensive. Yeah. So right now is when they're realizing that, hey, this thing is too much work. But their pride won't allow them to say that, no, curative tumelemewa chukweni. So then they're quietly going, ceding ground on their level 6. But we have to be brave. William Ruto, the president, must be brave enough to call it for what it is. That devolution on the curative side of things have failed.
Well, you had indicated that the only person who thinks of the health sector who saves you is it's the union.
Yes.
That is saving actually the patients and even the Kenyans. And I'm also looking at the hospitals that you've just said that they are already on strike. Yeah. Others have already issued their notices of strike and so forth.
Yes.
You have been in Empu, and I know you've led a lot of strikes.
Yes.
And there is a time I hosted one of an officer of the Kenya Union of Teachers. Yes. And there's something that he said that they once talked to you guys, that you come, they advise you, they give you tips on how to do these strikes for them to be fruitful. Do you think there's the doctors, and comparing with the teachers, that teachers are being treated better than the doctors in terms of when they go for strike? Teachers tend to be heard quicker than the doctors.
Not really. We are dealing with the two different circumstances, scenarios, where, you know, I'm having 48 employers, 47 counties and one national government to strike against. Yeah, teachers only have one person to strike against, which is TSC. You get that? 1. 2, a teacher who goes on strike, the worst that can happen is the children will repeat the exam or repeat the class. For me, I go on a strike, people are dying.
Yes.
And you can't undead somebody, untie somebody. If a limb is chopped, you in a motorcycle accident and you are amputated, it won't go again like a lizard's tail. It's gone. So sometimes we have to really think deeply before we engage in those strikes. We cannot afford to shut down everything completely, because you have to lose some semblance of services. Because you have parents and relatives that are also sick, you come from the same community. Yeah. So we can also not be too ruthless or having these so-called successful strikes. Yeah. But what is success? KMPDU is the only union that has given its members more than 100% pay rise. We used to earn 40,000 less than a decade ago. You get that? The 206 you're hearing about, we were earning 38,000. Yeah, and it changed. Yeah, so the key thing is that the government must follow what ILO says on strikes by essential workers. You know, this government, when you go on strike, they tell us you're essential workers, you can't strike. But when we're not on strike and we tell them we have issues, give it essential priority, they won't. ILO says that essential workers who are healthcare workers are part of them. When they raise complaints, not even strike, the issues should be sorted quickly. And even if an agreement is made, then you have to fully implement that agreement to make them not get agitated and go back to strike again. Right now, every single thing we have agreed on from the CBA 2017, we are still pushing for it 8 years later for its implementation. The basic salary changes, we had to go to court to win that case. We were paid half of it, the other half is not yet been paid. Each around medical covers, we have healthcare workers who offer services that they can't offer. I have a doctor in MTRH Eldoret whose wife was detained in the very place he works in when she fell sick because he has no medical cover. In Elgeyo Marakwet, they have no medical cover. Yeah, in KNH, their medical cover is you being treated in KNH. So if you fall sick in Kisumu or Mombasa, you have to come all the way to KNH to be treated. So there's a lot of nonsense that's going on, and every time you see doctors, nurses, all these officers getting agitated, don't think that you are no, they know how to flip this story that they wanataka mishahara waongezwe. Many a times we are not asking for pay rise. Many a times we're just saying take care of us to make us take care of Kenyans. very basic things. Yeah, I know of a doctor. I know 4 doctors right now who have cancer. 2 in Kiambu who we have to fundraise for their covered
treatment. Yeah,
I know 1 in MTRH, also stage 4 cancer. We have a WhatsApp group fundraising. Can you imagine how sad that you have to miss treatment or you have to be subjected to fundraising as a doctor to get services that you offer every single day when you are healthy? And that's why KMPDU keeps on saying that we might be a nuisance, we might look, we are a very restless union, but if the language that government understands is a strike, we'll give it freely.
Doc, there's something you said a couple of paragraphs back, and it's about the National Health Council.
Yeah.
Is that something that actually exists?
So what we wanted, after we found that the devolution had given governors to chew more than they can, we told them that out of these complicated things in this healthcare, surrender the human resource function to a commission. The commission existed in the Bomas draft, just like TSC, Judicial Service Commission, Police Service Commission. There was a Health Services Commission that was supposed to handle the HR functions of healthcare. Yeah. The only time it was removed was in Naivasha in the final draft, when they said there were too many commissions, and they said that kina nani wenye wako kwa hii meeting, it was healthcare workers. So what happened? It was removed without people considering the importance. And now we find ourselves in every county does whatever it wants on HR. Yet we guys are in the same country. Can you believe that in this country we can have my classmate or somebody junior to me who just happens to work in County X in a higher job group earning more than me, who was probably ahead of them, because maybe in the county I work in, they have not promoted. Can you believe that we are in a country where if today I got married and my wife was a nurse in Mombasa and I was a doctor in Embu, there's no chance of us as a family ever living together because we cannot move across counties. There's no inter-county transfer. When you're locked there, you're locked forever. Can you believe that we're in a country where in Migori they have 1 OBGY gynecologist, and in Nakuru they have 20 to 30 of them? Same country, same taxpayers. It's not fair to have these different ways of running healthcare in the same country, and this healthcare is not being funded by county-based resources.
Why not take this
budget from the exchequer?
Why not take this 10 from this county and just take them where there's one?
Exactly, and that's why we say that let us have a health services commission that will sit back and say that we have 16,000 doctors in this country. How do we distribute them? Cancer is killing us. How many do we take to train for this master's program? You get that?
Daktari,
it is so simple.
Yeah.
And every time somebody tries to push for that in BBI 1, the proposal was there. Governors went and blackmailed Raila and Uhuru and told them that if you put it here, we are going to oppose BBI. It was removed. Right now we have a chance. We have this proposal that was given the intergenerational conclave. Kenyans are opposing this idea, but I'm telling them this is a perfect place to look back at what has not worked for us in this constitution. We say that healthcare is not working for us, so and we say that we want a referendum on it.
You're for the conclave.
I am fully supporting any venture that can make us look back. Hii katiba tulipewa 2010. Does it make sense? Does it make sense to have chiefs and then have ward reps and administrators? Does it make sense to have the county bosses, governors, then you have county commissioners? Okay. Does it make sense?
Okay, so we'll get to the politics part of this. As we also discussed the SHA, I still want to go back to the fact that we have an imbalance of practitioners.
Yes.
So there's a county that has got more practitioners that it needs, like now you've said the OBGYNs
Yes.
Kuna mali wako wengi kuliko mali kwingine. Maybe kuna mali hata kuna oncologist na hizo vitu zote. And those are some of the things that you're pushing for. Is it possible to, as we gear up to have the Health Services Commission, we also just see how we can deal with that, first of all, that issue of Machakos County, for instance, haina gainers wa kutosha, lakini tukiangalia Marsabit wako excess, hata wanakaanga idle during the day. Is that a conversation that can be held today?
Yes, it can be held. No, after the last the June last year's demos, the president formed a health services commission. No, a health human resource reforms task force.
Yes,
and I was a member of it. And the idea was to look at all the challenges on the human resources of health issues, and we realized that the problem starts right from training. We call it production, where people realize that health is a marketable cause. So any Tom, Dick and Harry will open a college and call it a medical training college. any person with a private clinic adds some English name, John Hassan, what medical college attached to it. They have no lecturers, but they want students to pay fees and to work for them in those hospitals for free. You get that? So production, somebody just wakes up with a C+, say that, oh, I don't qualify for medicine in Kenya. I'll go to Russia, I'll go to Turkey. You go study, come back. You get that?
Or they actually qualify in those countries.
Yes, somebody wakes up in JKUAT, say that I'm going to have a program called Bachelor's in Ophthalmology. Ophthalmology is a master's program in medicine. But they don't care, they just create it there. They want money paid. Somebody says they're going to have a degree clinical officers. They're like, no. CEOs are meant to be diplomas to do a certain kind of job. When you give him a degree, who are they? Are they doctors or who are they? But since the confusion in the production, we say that we must have control around that production. Secondly, was about the training. That you get a county say that you want to go for your masters. No, you can't do OBGY or gynecology. We have enough of them. So they deny you, tell that if you can do ENT, we'll let you go to school. But your dream was to be a gynecologist. But
so we have gatekeepers in
yes,
that. Yeah.
Then they stop you from doing it. Yes,
is that
you can
legal?
still go to school. Yes, they made a policy on it. Yet you can still go to school, do your gynecology, and go to a county that needs you. And the other challenge in the training was that as a county, when they release you to go back for your masters, they have to pay your salary on that study leave. But you are studying your masters in MTRH or in KNH. We are giving services, you are doing surgeries, SHA is paying them. And this money they pocket. So we told them.
And you as the doctor, you're getting nothing.
So we told them, why can't we have an arrangement where when you go back for your masters, Minister of Health sponsors you for school fees and pays your salary. When you graduate, they look at the country. Wangalia, where is the shortage? Then they send you where the actual shortage is. But there's no communication between counties. There's no communication between counties and Afya House because they just mistrust also around people fighting for resources.
Na hiyo si kitu tunaweza enda tuketi na Duale tu saizi. Na tumwambie boss, cheki. Ngori ko hapa.
Actually, that issue of inter-county transfers, like you can have some medics from this county to another county could solve that.
Yes.
If the president can just say, let there be hustler fund, and there is hustler fund. See, he can also just say, let there be this division and we take these people there.
I can assure you,
executive order.
It is easier said than done. The governors have approached their work and the counties like private property. They are like small gods. Yeah. If you dare touch anything, touching on healthcare, they'll tell you, you are now fighting devolution. And no, right now the president has his back pushed against the wall, so he does not want to do anything that disturbs the apple cart. I'm very sure that in his second term, God willing, if he gets there, he can be brave enough to do it. Right now, with the kind of control that governors have on the politics of the day, I don't think that no president can ever touch that topic on a first time.
If he can't do it now, I don't think he can do it in a second term.
So Kenyans then must decide. Kenyans must decide what works for them, and that's why that conclave idea must be that if the politicians won't feel our pain, let us have a discussion where we feel our own pain. We cannot all be going to parliament to talk, but in this conclave or this whatever you want to call it, we can have Kenyans speaking. That mother dying from cancer can come speak and say what this is not working for them. That child going to fail for school, going to school, they're going to come and say what is bothering them. We must have a place where for the first time as a country we sit and agree for fact that healthcare in this current arrangement has failed miserably.
Well, Daktari, I want to understand what impact or effects does this reshuffling of the CSS for health and the PSS has on the implementation of those some of the issues that you had on the CBA?
Let me tell you, sometimes it's very frustrating, and I also feel the president's frustrations when he keeps on changing these waziris and all that. But he's not curing the issue. It's like having a child who is having fever, and the only thing you're giving is paracetamol, and the fever will recur and paracetamol again. When you don't know whether is it a bacterial infection, is it malaria. We must diagnose Kenya's healthcare problem for what it is. Even if today we took healthcare and put it under the State Department Office of the President to be run by the HE himself, there are always going to be challenges because you cannot run this critical sector with 48 different ways. Honourable Duale has come. The one good thing that I appreciate about Honourable Duale and what is doing differently from the other two ministers is that the other two ministers were very competent. In fact, the second one was a doctor. But healthcare has so much vested interests, so many business interests that you don't know this toe you are stepping on belongs to which ring you have to kiss. You get that? So what Duale comes with, that Duale comes with, first of all, the full backing of State House. 2, it comes that he has been in Parliament, he knows the politics of the day. And being a career civil servant, he knows inside out who, what, when. So when he comes and starts giving orders and making decisions, nobody's going to threaten him with anything because he talks to the boss directly. Yeah. So with that kind of power that he has come with, the political will he has come with, he can make certain changes. But I can assure you, it will not last long because we are putting these changes on an individual. Can he really push it for 2 years? That's one question. Secondly, can the other 47 governors align with this vision? Otherwise, if we don't have that, we must have this thing institutionalized. Even if Dr. Oluga is there, he was a unionist, I can assure you as KMPDU, we are not holding our breath that is going to do anything because the system is broken. And if the system is broken, no matter who, if you give even the best pilot a broken plane, they will crash it. Because we have to ask ourselves that in the current arrangement, are the counties ready to take instructions from Afya House? Because Katiba inasema kwamba the policy directions are based at Afya House. They are not ready for Afya House. Are they ready to cede funds to the counties for functions that are already devolved? Afya House cannot be getting 140 billion in budget plus donor money around 80 billion. When healthcare is 90% plus devolved, are they ready to give this money? The other one for UHC workers, they to be paying them from Afya House. They refuse to send the money to the counties because somebody wanted to add ghost workers. Wakule pesa wao pia. So are they also willing to release money to counties to do their job? So it's a fight for resources by the leaders in healthcare. We must, as Kenyans, say enough is enough. It's not good enough to tell me that you have built roads or built bridges or built stadia. All those things will not help me when I'm dying. When you put 600 billion in education and you don't take care of my health, a dead professor is a dead human being. Nobody cares about the PhD. So no matter what you fund, even if you hire that many policemen, a sick officer won't be going to work. Right now the policemen don't have a proper cover. So we must get to a point that Kenyans know that at the center of it all is healthcare.
Sasa wa Kenya hapo wanaweza fanyaje? How can Kenyans help? Because at the end of the day, the most people can do is make noise, go to the streets, get shot, die, repeat. You know,
that's why I've said that I'm very happy that we've been talking about healthcare lately. Because for a long time, Kenyans refuse to discuss healthcare as an agenda politically. But right now, you can see no single political event goes without healthcare being discussed. Means that even the politicians right now know that healthcare has a political price to it. 1. 2, Kenyans must decide that in the coming elections, somebody must set for you their health agenda. Not at the president's level. The MP, you have MPs who sat and passed the SHA law with all the challenges it had. We have to ask them those questions. We have those governors who are chewing our monies. We have senators who have been elected to supervise the governors. You know, sometimes I get so pissed off with Omtata. He speaks and wants to check on President Ruto, but you go to Busia, healthcare is collapsed in Busia. Yet the work of a senator first and foremost is to check the governor. Yeah? So we have to hold our politicians accountable. 1. 2, we must push for that conversation. It's not enough for someone to say that we won't talk, we are tribalists, we are leaderless, we are what less. No. We must agree that we must talk on what's not working for us in this country. So Kenyans must decide on that. And finally, my plea to our leaders. Sometimes you must listen to the people. You cannot be seeing Kenyans crying on TV every day, crying on social media every day, crying on the struggles that they have with. You cannot be seeing people sitting on the street with wounds, begging for money and not feel anything. You must feel ashamed when you have to travel out of the country every time you fall sick. When you know you are a voter, even your ward manager can't afford that. So I plead that the leaders must also have ile roho ya huruma. And finally, the president, Kina Raila, they have to be brave enough and reverse some of these mistakes. A good idea must give way to a better idea. The evolution of healthcare was a good idea that has failed, and we must learn that we can go the Cuba way. You can the primary healthcare is put on the community level. They can have those CHPs walking around doing BPs, taking sugars. We can have the CHPs doing deworming kids, giving them health education, teaching on hand washing. That. You can have the dispensaries, vaccines, changes, and all that. Then After that, the health center, these outpatient things, home and nini, we have CEOs who can handle that. Then any moment it moves to a curative side, which is very, very expensive, level 4, 5, 6, you then let somebody have a national standards.
Okay.
Let me ask you a question, because most of the time we have civil servants who are capable of getting these medical covers and so forth. And the other day there was that push for public servants or the civil servants to start using public facilities, health facilities. Do you think this in any way can be able to address the issues that we are having in terms of the decisions that people are making, those who are in that docket?
Actually, Daktari, I want you to hold on that thought. You'll answer in the second hour, where we shall also address the SHA issue and the political will that we've been mentioning here, and also the solutions that we can have today on the, are we on the 7th day? Yes, the 7th day of August 2020. Allow me to give a few shout-outs here. We do have Samrak watching from Boston, Massachusetts. Samrak, thank you so much. We also have Collins Kemi. Is it Kemi or Kemei? Asante sana for tuning in. We also do have Langat Musema Ukweli. This is Langat Musema Ukweli. Amesema Mombasa Nairobi Expressway usahihi will be done in collaboration with USA. Okay, responding to something we had spoken in the previous hour. Also, Techden Writers, amesema very good morning to you. Thank you so much. The Blue Moon, habari yako. Njuki Mungai, habari yako. Nancy Abura as well, thank you so much for tuning in. Mtsetse, am I saying that correctly? Good morning to you. How are you doing? Alden Kidula as well, a very good morning. Asante sana na Fidelis Mayabi. Asanteni sana for tuning in. Let's continue the conversation, Daktari. And I think Patricia had just asked you a question. Patricia, kindly, for those who are joining us right now, if you could just repeat that question for them.
Well, it's about that proposal and the push for civil servants to start using public hospitals. And I was asking, do you think this is able to address the issues that we have of the laws they are coming with? Because I know they're the ones who are working in the government and they are part of coming up with the laws, that is governing our issues to do with health in our country.
Yeah, I know the proposal from Honourable Jalango, MP for Langata. It's a very lazy proposal. Let me tell you, equity is not about cutting the legs of those who are tall. Equity is about giving a stool to step those who are short. So you don't tell the civil servants to come to these poorly run public hospitals to make services be improved. What you do is that you push for more funding to improve the public facilities. You push for more money. You push for a law for annual recruitment of healthcare workers they do with the soldiers and the police. You push for laws to safeguard devolution. You push for laws to punish corruption at the county level. You push for laws to compel Afia House to release money and functions to the counties if you have to. But just deciding that you choose the lazy one of that, and then in the you are seeing a crack, then you say let's block it with some cement when you're not diagnosing the basic issues. So yes, you can push for public service workers to go there, but it won't help. Just like we had the civil servant medical scheme in NHIF. Then under SHA they removed it, and then they say that we are all equal, let's all get the same cover. But that's a very mistake you are doing, because you are cutting the legs of those who are tall. If they have a better cover, make SHA be as good as their cover. Don't take them to this other low level cover. 1, 2, these public servants, every salaried individual in this country supports a minimum of 9 individuals. As Miskellah Dennis here, I support average 9. My mother, my retired father, a sibling there, an uncle there, grandmother, and all these people, you're not just feeding them, you are paying for their SHA contributions every month. Because where is my retired mother and father get money to pay for SHA? Or my grandmother? I have to pay for them. So when you are coming for me already to do the 2.75 of my gross, I still have to pay for 4, 5, 6 other people into this SHA. So it makes no sense looking at it from the point of that you're a privileged lot. Instead, open the door for the others who are outside to join us in this better healthcare by budgeting and allocating more resources there. It won't help. I can assure you that what it will simply do, to simply make me as Miskellah get a private insurance Then I use that private insurance to go to a private hospital. You can't force me to go to a public hospital. What it does, when I have more money, I'm not giving to a private insurance. I have less money to pay for my grandmother SHA contribution to send to the people I'm supporting. So the more you frustrate the public servants, the more you are cutting your nose to spite your face.
So lazy or not, Daktari, is it something that can actually help push, even if it will push a centimeter out of 1,000 kilometers?
No.
At all?
You know why I will not support that? Because it's like telling somebody that this cup has poison. But instead of us saying that we get a fresh cup, you are saying that let's all drink the poison. You cannot say that by forcing these people to public hospitals, you're curing a broken system. Just cure the broken system that all of us can enjoy it. So it will not work. First of all, MPs, you know how much they love themselves.
Yeah.
They have 10 million shillings per year covers. They're not going to. Have you ever been to a public hospital recently?
Yes,
the
I have.
Queues. Then you go to the lab. KNH is heaven, brother. Then I was in KNH for my masters.
Yes.
And you find yourself in some of these county hospitals, even the basic lab just ya kupima tu mkojo, hata kupima damu hakuna. So unakuja hapo unaambiwa kwamba level 1 to 4 is free, private healthcare fund is exchequer fund, in and out without paying. Then you arrive, you wait for 2 hours for the healthcare worker to see you. Ukipata kama hujalipwa mshahara pia wako on strike 72 days kama Kiambu utawaona. Then unaambiwa enda lab hakuna reagents, hakuna kitu inafanya kazi, unatumwa nje upime ulete. Then daktari unarudi unapata daktari hata yuko amekimbia kupeleka mtoto wake hospitali kwa hata ana medical cover. He comes back in the afternoon anakuambia hii kwa sababu enda upigwe x-ray. Ukienda x-ray ama ultrasound, tuna ile haribika last month hajatengenezwa. Unatumwa nje tena, unakosa fare ya kwenda kuipiga ama pesa ya kuilipia, unapotea 2-3 days ukienda kupiga picha. Unarudi unambia uko na shida, nunua hizi madawa. Ukienda kwa pharmacy hakuna madawa, unaenda kutafuta pesa kununua madawa. So hii SHA yako yote ulilipa, how has it helped you? Haja kusaidia? And that's why Kenyans are not joining SHA, because it adds no value to them. The hospitals are ill-equipped, ill-resourced, pharmacies are empty.
Okay.
You cannot start a journey that you say that you want to go to Kisumu, and the first thing you want to start with is that you want me to pay fare before I've even seen the car taking me there. People are made to pay for services that don't exist. Why can't we first of all fix healthcare?
Let me ask you, you talked of the doctors. I mean, the governors, the MPs. You said an MP, of course, will not go to a public hospital.
Yes.
Kwenda kutibiwa manake akona cover kubwa. So assuming today they have been forced to use the public hospitals, and now we know they are the ones who come up with the laws, and the laws, of course, governing maybe also the budgeting, the budget that the medical or the health sector gets. Do you think this can improve the situation?
You know, it really indicts as Kenyans the type of leaders we elect. If you have to force them to go to those hospitals for them to feel your pain, then it shows the kind of characters we line every year, 5 years to vote. If they cannot see the pain of those women queuing on the side of the road in Kilimani to wash clothes, if you cannot feel the pain of children dying with heart conditions, if they cannot feel the pain of kidney patients who have to dialyze and sell cows to get dialysis, that they have to be forced to go to those hospitals for them to make them work, then the indictment is on us Kenyans. I can assure you that they simply will take... No, you can't force me where I seek care. You can't force me. They'll simply get other insurance. In fact, the people will benefit in that law is private insurances. Because once you force them there, people will take private insurance covers and go to private hospitals. But more importantly, private hospitals are not our enemies. There's nothing wrong with seeking care there.
True.
The only thing we must know that they're in it for profit.
So we have
they're in it for profit. And anytime you put a social function as a business venture, those who suffer are those who are the poor.
Tuko na swali hapa daktari from Agre K Chabeda. Amesema from independence and for 20 years, health and education were devolved to the city, municipal and county councils. The system worked. Centralization was the start of failing primary health care. So I don't know, do you agree with Agri?
Agri says something very important towards the end. Centralization is what
was the start of failing primary health care.
Yes, and do you know what primary health care is?
Niambie.
1, 2, 3.
Okay.
That's what I've been saying all along. See, those municipal councils In Dagoretti here there was a health center. In Dandora there was one. Mbagathi was Mama Pangani, Pumwani was one. You get that? Do you know what it was about? Preventive medicine. That's why you say that Kamambaya. Let's take back 1, 2, 3 to the counties. Let them focus on deworming, on changes, hand washing. That is what the Kanjos were doing all along, checking on the meat ventures and all that. The moment you hit curative, there were the Nyayo wards built by President Moi. There were these hospitals. If you go to all districts, there were district hospitals, and they were built the same way because it was a national program. There were the provincial medical officers, there were the district medical officers. It was never devolved because in healthcare, you want a one command center. We are saying we are approaching COVID like this. We are all that way. These are our cancer policies. We all that way. On maternal health, this is what we are going to do. On vaccination, we all push together. Right now, different governors are doing differently. You go to Nairobi County, Sakaja has hired 200 doctors. He has hired people. He has activated all these facilities. You're saying hallelujah. Then you go down Kiambu Road, you find a 74-day strike within healthcare workers out there and still crying. Then what do? You have still failed the same Kenyans. Then you go to Masabit, where a governor is boasting of doing the first cesarean section ever. But yet, the kitchen is closed. Patients have to buy food in the market and eat in the ward. What are you doing? Then you go to Nakuru, where everything was perfectly working. They have a cancer center. They have all these things going on. Yet, in the same country, such inequality. And the saddest bit of it, that all these counties' healthcare are being funded by the exchequer. Mark you, the budgets for health in the counties are not from market collections. They are not from this cess you see on the road they're collecting cess. They are monies from the exchequer. So it means that even that poor mother dying in Turkana because of failed healthcare pays the same tax as this person enjoying healthcare in Mombasa County. We must have a country where citizens have the same level. You know that whether I fall sick in Gishu or in Marakwet, I will get the same kind of care. And nobody speak about that. Nobody talk about standards because you have left too much decision making to politicians who worry about the next election.
Daktari, SHA has been one of those things that I don't even think Kenyans understand, to be honest. Because there are some people who will give you success stories. They'll tell you, nilienda hospitali nimetibiwa. Mwingine anakuambia this thing is just, it's a monster by itself. When SHA was being formulated, when that bill was being drafted and all those things that happened, where was KMPDU? I don't know if you were the SecGen then, but mulikuwa kama madaktari.
Yeah, so a good question. And today, probably I'll make Kenyans understand what SHA is all about. And first of all, I have to say that those who say that is working and those who say that is not working are all right. They're both right. Yeah? Because if somebody showed you a tail of a giraffe and somebody only uses an antelope, a tail of an antelope, somebody else was shown a hoof, na moja aseme ni antelope na mwingine aseme ni mbuzi, you cannot say one is wrong because it's based on your experience on what you saw. So those who are saying it's not working for them, they're genuinely concerned. It's not worked for them. Those who are saying it's working for the bit they went for, it has worked for them and they're just right. But let me go back to your question. KMPDU has been there, and SHA is one of those issues that really frustrates me, because we from the word go, and this is not a blame that I put even on Honourable Duale or even Kina Deborah. This is a blame that I put right on the doorstep of Parliament. When SHA bill was being formulated, KMPDU submitted a 25-page document telling them what could work, what could not work. From the word God, we told them that first of all, the financing model for Kenya cannot work, where you have to finance healthcare through contribution, kila mwezi, ama whatever. Kenya has only 20% of its population on a salary every month. So those are the only people you are assured of deducting every month to get money from them. The rest are in Juakali, who there's no way of compelling them to. They put a clause in the initial bill that if you don't pay SHA, you can't get government services. We challenged in court and won, because Kenyans pay taxes. You can't deny me services because of another additional thing that I might not need or I don't want to participate in. The other thing we told them, that these guys in Juakali, how will you know what somebody should be giving? How will you know that we atatoa 1,000, we atatoa 200? Because when you put them in testing, Kenyans lie. You tell them which house do you live in, mtu anasema ni matope. You get that? Because ukisema ni mawe utalipa more.
Kuna mahali niliona swali nikiregister for SHA, wakaniuliza ni kama niko na choo.
Yes.
Na hiyo choo inakaa
aje. Yes.
Hey, I found that very...
Yes, because they're using that based on the toilet you're using to estimate how much. Mean testing is one of the most inaccurate ways of knowing social determinants of economic abilities. We told them that. Or even today you have a motorcycle, you say that you have a motorcycle when mtu andudhi wakwekea 600. Kesho ugongwe na gari mrudhi imeanguka. Maybe ilikuwa ni ndudhi ya umechukua na hii mambo ya pay as you work on it. Ama you have 3 cows, umeandika hapo kuna ng'ombe 3. Kesho foot and mouth disease wamekufa, you are cowless. Yes. Yeah. How will you contribute? So we told them that it was not possible. Yeah. So we told them that the easiest way to finance healthcare is through taxes. Everybody pays taxes. Ukinunua sukari, ukinunua nini. So we told them, can you attach even 1% or take 1% of taxes and put it on healthcare? They didn't listen to that. So all these proposals were not listened to at parliament level, that we went to court and won some cases and lost some cases. But along the way, we were told that probably you guys are fighting this SHA too much. Maybe it's not working because you have poisoned people. So we said as KMPDU and healthcare workers, let's step back and support it. Let's not say that we want this child to be born and to start running. Let's step back and support it. And we have been very, very supportive of SHA. We have 25 million people who have registered. But they're only registering because they were told that level 1, 2, 3 is free in the primary healthcare fund. So let me make Kenyans understand what our SHA is. What do I level? SHA is a social health authority, and this authority manages 3 funds. And the first fund is the primary healthcare fund, which handles level 1, 2, 3 hospitals and 4. And this fund is supposed to be funded by taxes by the exchequer. They asked for almost, was it 14 billion?
Yes.
They were given 8 billion. So it's a drop in the ocean. But this is a fund that ensures that you just walk in and walk out without paying anything in level 1, 2, 3 and 4. But as I told that those hospitals are just ni jina tu, ndani hakuna madawa, hakuna vitu. So people are then forced to go to higher level hospitals where there's this fund called SHIF, the second fund. SHIF is like the NHIF that went. It's the contributory scheme that you give every month. And it only kicks in ideally when you're admitted. So what do the clever Kenyans or the clever hospital owners who want to make money do, since primary healthcare fund is a little? They'll admit even cases that don't deserve to be admitted. To make money.
Sasa hapo ndio nataka tukuje.
Yes. So we'll get there.
Yeah.
So hapo already, this little money people are contributing, this 4 million people are contributing, is already being misused because you come with the flu, unafaa kupata dawa uende nyumbani, dawa hakuna, so we'll admit you, then we'll charge 16,000 to SHA. Then finally there's the third fund, the emergency critical illness and chronic illness fund. These two were supposed to be an exchequer fund funded by the taxes. Was to cover for things like dialysis, things like cancer treatment and all that. They asked for 47 billion, they got 2 billion. Another drop in the ocean. And that's why you've been told after ICU, top up. After this, add this. But the most critical thing that Kenyans were never told, or Kenyans were wrongfully told, in the desperation for government to make people buy into SHA, the certain pronouncements that they made that are hurting the fund. People must know that SHA is not an endless pot of fund. It is finite. Iko na mwisho wake. So when you tell people that ukikuwa mgonjwa ama ukipata accident, you can pay on your way to the hospital, you can register or in the waiting bay na ikutumikie. You are going to suffer something called adverse selection, where Miskellah niko na gari, sina insurance, nikisha igonga ndio nakata insurance. Even if you make me pay for the whole year, like there are people are paying now for the whole year, I pay maybe 12,000 for the whole year, but my treatment is 200,000. Kila mtu akifanya hivyo, the fund can't be sustained. It will fail. In insurance, there will be more people paying than more people using. So the fund is always having more income than expense. That's one mistake that they did in the desperation. And how to cure it is by putting a waiting period. That you have at least 2 to 3 months waiting period. So you know that you shouldn't have a cover because you don't know when you'll fall sick. So there are going to be more people contributing. But right now they're burdening salaried people. You have 25 million registered. Only 4 million contributing. And out of this 4 million contributing, 3.8 million are salaried people. You can't do that.
Let me take you back a little bit. You've talked of level 1, level 2, level 3, level 4.
Yes.
So I do not, it's not a must that I have a SHA, a cover for me to get treated in this level.
That's a good question. You don't have to be paid up for SHIF to access primary healthcare fund and the emergency chronic and critical illness fund. You only need to register. But to register, you can access this fund 1 and fund 3.
Register what?
So you register 147 hash SHIF.
Okay.
So once you register, they have your data. Otherwise, people lipa per month. You access primary healthcare fund for free and ECCIF for free because they are taxpayers. As a taxpayer, is your right.
Ngoja tu kidogo daktari.
Yeah.
Mimi nimeregister kitu inaitwa SHA.
Yeah.
Hiyo bado ndio SHIF.
Ndio hiyo.
SHA is a house.
Yeah, I want us to be clear.
SHA is a house.
Yes.
Primary healthcare fund is 1 bedroom. SHIF is a sitting room. ECCIF is another room. So but they're all under this house called SHA.
So I have a SHA number.
Yes.
Sawa.
Yes.
Mimi hiyo ndio kitu ninajua.
Yes.
Whether I've paid or not,
yes,
it's neither here nor there. So if today I happen to walk to panaitwa aje hapa Mama Lucy Hospital, I will get treated for what exactly?
Yes. The moment you just pay for SHA, isha kufungulia gate into that compound called SHA.
The moment I register or pay?
Register too.
Okay.
Ukishaingia kwa hiyo gate, you can be treated for free in level 1, 2, 3 and 4 outpatient just by registering, because this one is being run from the taxpayer fund in the exchequer. So as a taxpayer, you have a right just by paying taxes.
So there are different kinds of outpatient services, right? So can I get dental?
You can get anything that does not require admission.
So I can be treated
any
for
disease that malaria.
I can get treated for syphilis when
anything. Bora admitiwa. The moment you are admitted like this, SHIF kicks in. The second fund kicks in.
Okay. So, and the reason I'm asking this, Daktari, is because I want us to understand, because there are those success stories and there are those other stories, yeah? So
and I'll get there.
Yeah. So, and I'm asking because someone is probably listening and they're wondering, okay, sasa nilipe nisilipe, but nikienda, so kuna mtu ajenda hospitali because anasema niliregister SHA ama hataki kuregister because they're like, I don't even have money to pay for that thing, so even if I register siwezi enda kutibiwa. So what we're saying is I've registered for SHA, I've gone through that mean testing, nikawambia ninatumianga pitlatrine, tunatumianga 100 of us, so I can actually now with my registration walk to Mama Lucy Hospital today and get treated for whatever outpatient disease.
Yes.
Thank you.
And you can still also access ICU and dialysis just by registering without even paying anything. Do you know why? Because these two funds, primary healthcare fund and the emergency fund, they are being funded by taxes, not by contribution. So anybody who is a taxpayer, a Kenyan, will access those two funds. The challenge comes in now this second fund, SHIF. And SHIF is the NHIF of days gone by, where you now have to be paid up for SHIF. That's why you hear about that we have 25 million people registered, but only 4 million are paying. Because people registered to access these other two funds, but they can't access the middle fund. And this middle fund, you are now being told you have to pay for it annually. If you are kwa mjengo.
Sasa ndio ile ya SHIF.
Yes.
Hii ndio ile sasa, God forbid you get admitted. Ulale hospitali.
And now there, without the debate comes in, is SHA working or not? Is that those who are using SHIF are getting the services. You're admitted in a lipa. Unafanyiwa surgery in a lipa. But there's nothing to clap about. Why? Because NHIF was doing exactly that. Where issues come is in these other two funds, where you were told when they were selling this SHA idea that utailipa chochote outpatient. You get that?
Yes.
Utaiongeza kitu kwa dialysis ama kwa cancer treatment. That's what they sold you. But since they have allocated less funds into these two funds, you have to pay for it. And that's why now this other group of people saying it's not working are talking about that nobody is wrong in this debate. 80% of Kenyans go for outpatient services.
Yes.
And when they go there, they have to pay. So to them, it's not working. Only 20% go for the inpatient, who to them, SHA is working. Then they have other extremely sick dialysis cancer patients who also have been wronged. And why do I say so? In cancer under NHIF, if, for example, my wife and I are both contributors independently, I had 600,000 for my contribution to treat me for cancer. And if I deplete it, as her husband, I can use her cover the other 600,000 for my side.
That was with NHIF.
So that's 1.2 million per household in NHIF. What did the SHA do for that fund? They said that now they're giving you 550,000 per household. Now it's no longer per individual. So if I finish my 550,000, I can't access anything. God forbid, if my wife and I both have cancers, I finish the cover, she can't access even her own 550,000 because it's only 550 per household.
So is it possible to register both of us, but I do not declare my wife as my spouse?
Yes, that is okay. But how? but after doing that, how will you access her fund if she's not your spouse? The whole idea was that we wanted a pot of 1.2 million per household to cater for cancer. But now they only have 550. Yeah. The other thing that politicians and those who are selling SHA didn't tell Kenyans, that SHA was not meant to cover for all your healthcare expenses. There's nothing like free healthcare. Somebody must pay for it. And according to the Ministry of Health, our healthcare budget needs to fund all our healthcare needs in this country is 550 billion shillings. SHA collects around 325 billion plus government allocations for the budget. Then wazungu watakuja waongeze kina Trump ongeze some 50 billion. Inakuja around 380 billion. You still have a gap of 70 billion to plug. And somebody must plug for this 70 billion. And who do you think it is? It's me and you. That's the that's the co-payment we are complaining about.
Okay.
We have to get back and tell Kenyans that SHA's, and the idea was that to stop you from dying. Number two, to stop you from being broke. For example, if you have a bill for 500,000, SHA can pay for you 350, but you'll have to top up the 150. The 350 have saved you from selling your land. But you can now look for the 150. If Kenyans understood that concept, they have no problem chipping in. But when you go selling to them, telling them that healthcare will be free, unaingia na kutoka, then you know they'll be feeling cheated.
Yes.
Because you didn't tell them the truth.
I have a question in regards to the drugs.
Yes.
Because when I have my private insurance cover, I will walk into any the big hospitals, the private ones, get treated, and it will even purchase the drugs for me.
Yes.
So basically I have not spent a coin apart from my premiums that I'm paying.
Yes.
So now, is SHA also giving me the same?
We told SHA when we were starting that you must tell healthcare providers that if you want to be in our contract as SHA, as a provider for our clients, you must have this number of doctors, this number of wards, this number of drugs, blah. As in, you should have declared upfront what you have. Then anytime you don't offer those services, like kama hakuna dawa, hakuna x-ray ama nini, SHA should strike you off to stop this thing of patients having to buy drugs outside. But SHA let them have a freeway. So these are how Kenyans are being stolen from. You go to a hospital and unafanyiwa surgery, ama unaonekana inpatient and all that, and SHA pays 100,000 or 200,000 for the surgery.
Yes.
That's your money you contributed to. But after this surgery, you need painkillers, you buy out. Antibiotics, you buy out. X-ray ulipiga nje. So they have stolen from you because while this hospital has been reimbursed full package, because that 200,000 has drugs in it, X-rays in it, which they didn't offer you. You had to dig in your pocket again to get them outside. So they're stealing from Kenya these hospitals, be it public or private. And that's why I say that from the word go, we should have first of all have gotten the car, serviced it, then told Kenyans, get me fare to use my bus. We should have ensured that we have enough healthcare workers, enough hospitals, enough drugs, fix in all the 4 pillars of healthcare. Then finally, come tell Kenyans, this thing is not working. Now you can come pay rent to live in this house.
So basically, silipi with drugs.
You are being paid for, but the hospital has no drugs.
Okay.
You get that?
Yes.
Can I demand for them and niseme pa sitoki mpaka munileted antibiotics zangu?
Thank you. But who will listen to you when you come to that district hospital? Utambia nani?
I'll strip naked and shout.
Actually, sometimes back, somebody, one of the pharmacists, told me that whatever we have here cannot cure you.
Yes, because look here, a governor brings a huge lorry. First of all, half of it is empty. Wameka boxes na huku mbele ndio wapige picha for social media. Na ndani ni umeleta boxes za Panadol na gloves. Sasa hizo wewe ulikuwa umeitisha antibiotics. So what do you help that patient with?
So that day, actually, they told me that whatever we have here cannot heal you. So whatever I have prescribed for you, you must buy. You must top up cash to buy.
Yes, and also Kenyans, also, apart from just blaming the political leaders, Kenyans, you must also search within our hearts and have a culture of honesty.
Yeah.
There's something called moral hazard in insurance, where somebody says that since I have insurance, I can just use it. So any small thing, kama sisi middle class, uko na private cover, any small thing umeenda hospitali, any small thing I even think that you can just buy over the counter a painkiller, umeenda hospitali, then you end up depleting this fund. And ukienda pale hospitali, you also get another greedy hospital owner or a greedy management or a greedy doctor or whoever it is, who also give you the most expensive drugs. You can take amoxicillin for 100 bob, but they'll to give you augmentin, or they'll to give you ceftriaxone. You get, because you have a cover unapewa. When you spend unakwambia every patient who comes, make sure that minimum I may spend 10,000 shillings. You're going to deplete the fund. We must be honest as Kenyans. We can not keep on admitting patients who don't deserve to be admitted, because that's where the money is. Get that?
Yeah.
As you know what's lacking, also I don't blame Kenyans for being dishonest, because our leaders are also dishonest. Unaambia kuna pesa, but you see how they are living lavishly. So it's all cascaded. Ukuna ka clinic yako, you also have to steal from this SHA. When ni mgonjwa, you have a insurance cover, you just say that, let me just walk in for this headache, nifanyiwe x-ray ama MRI.
Daktari, I want to understand, who came up with this proposal of the SHA thing?
SHA, sometimes I also wonder. Why I wonder? Because in all honesty, and we are going to be accused of being nostalgic of days gone by, NHIF was one of the best things we ever did for this country. There are very many wrong things he did, but NHIF, and the only amount of money that NHIF needed to cure, because we were told that SHA was coming to cure the stealing, the only money NHIF needed to cure the stealing was 700 million to fix the systems. You don't have to burn your house because you have seen a snake inside it. You get the snake out. But be as it may, we were moved into this SHA for ideas that were very noble, that Kenyans should not have to spend when they fall sick, or don't have to die because they can't afford healthcare. Perfect idea. But you cannot have that idea by breaking all the rules of common sense. The first rule is that you have to have more people contributing than falling sick. You cannot have that idea that unakuwa mgonjwa kwanza unalipa. Number 2, you cannot use mean testing to judge what somebody is going to use to contribute.
People will lie.
Yes. Number 3, you have to know your demographics. You cannot have more people in Juakali and you want them to pay willfully every month. Kila mwezi watafanya hivyo. And even when you tell them that now they are going to pay per year, you have even worsened the situation now. Why? Because they can't, first of all, that woman who makes 200 bob in the village is stealing land. Ata collect your pesa ifike 6,000 siku gani? Haitaifika. And then tell them that they go and get it from Hustler Fund. Which is the first thing they've been told by Hustler Fund, kuna deni au kulipa. Ama, you have to pay 4 months upfront to access your Hustler Fund. So you end up locking more Kenyans out. The people you are intending to save, to rescue, you haven't left them worse than you found them.
What is your view on these hospitals that have been downgraded? You have an hospital that was grade 4, but it has been downgraded on the basis of performance, bed capacity, and so many other factors. Actually, it has happened. We have over almost 1,000 of them.
That is one thing that I'm really proud of Honourable Jalango on doing. Somebody had to be brave to tell it. You cannot wake up one day, have like a single room, then you go and bribe somebody at the regulators, then they tell you they are level 4. Do you know why they are doing that? So that they can access higher, the primary hospitals, the 1, 2, 3 are given less capitations and they can't even access SHIF. So you have to access SHIF, or even NHIF back then. So you are punching above your weight for you to access that. But Dwale was like, no, you guys are stealing from Kenyans. Go down to level 1, 2, 3 where you belong and offer outpatient services. What you can afford. You don't have a single room in Isili and you are making claims of 400 million in a year. What are you doing in that single room with the one theater, which cannot
calling it a level 4?
I want also to just blame doctors for a second here.
Yes.
Because one of the things that came out in that report that CS Dwali had to shut down a couple of hospitals is the fact that kuna daktari hapa anatibu mtu at 9:30 anamtibu hapa let's say gynecology. Umefanya treatment hapa and then 10 minutes later you're treating someone in Embu. I mean it's kind of impossible.
Of course the issue around the issue around sharing of credentials. And that's why they've taken away the OTP.
Right.
Where somebody has a hospital somewhere in Marsabit, they have no doctors, probably have a clinical officer, then they tell you to me credentials zako, I log in, I bill this patient. It was not making sense at all, but there are ways of curing that, and they have now put the biometric. My challenges with this government that They sit in very, very nice air-conditioned offices and forget about the plight of what Kenyans go to. Biometric requires internet. Have you done your research that how many hospitals in this country or areas in regions in this country have internet interrupted that the biometrics can be smooth? 2, the biometric machine is 24,000. Do you think that those hospital owners have the money to buy those biometric machines? 3, where the redundancy measure that if it fails they can resort to this? You must have a redundancy measure. If he fail, but now you watch TV, people are stuck. What about that patient in ICU? Utamuinua from ICU kuja aweke fingers kwa casualty. Solutions that are not.
I'm so sorry.
Yeah, it's not fair. We must think about when you're making any law, any declaration. Think of the worst case scenario, then you build it upwards.
But I'm also asking, just in terms of what the KMPDU is doing, to also reprimand some of these rogue practitioners.
I agree with you fully. That doctors come from this community. If you had a sack of oranges and you picked blindly, you will pick an orange. You won't get an apple. So yes, if Kenyans are dishonest, if politicians are dishonest, so definitely even the healthcare workers, some of them are going to be dishonest. And KMPDU, we tell our members that we will never ever condone any form of corruption or stealing. Ukishika ukiiba dawa, carry your own cross. If you're caught, and we, even when they were in Nakumicha was busy blaming NHIF and doctors for stealing, when KMPDU was fighting SHA initially, we were told that we were cartels fighting for our stealing. We told them, tell us one single doctor or nurse or whom you have caught stealing from NHIF, and you will even hire a free lawyer for you guys to use to prosecute him. Same thing. If any healthcare worker will be caught performing any act of corruption, KMPD is more than willing to even testify against them, because we know the pain that our members go through when they can't give services to Kenyans. You know, when a patient comes to me here, a pregnant woman who needs a scan, and there's no scan or they can't afford it, it is me who feels her pain. When she comes bleeding and she has to bleed out and die because you couldn't diagnose her properly, it is me who have to face the grieving father and the orphaned children. It's not some minister or governor in some air-conditioned office. So we know what it means when healthcare is underfunded. We know the pain that our patients have to stay 2-3 days without medication because bado wanachanga pesa, or they have to wait for a week or bado wanaenda kuchanga watu kutoa damu akuja afanyiwe surgery. We feel their pain real time. And that's why every single day KMPDU asks ourselves that how comes that the politicians, the people who give our money, don't feel as much pain as what we feel for our patients.
Let's talk about the looming strike, the one that you said is about to mature.
Yes.
We see, and I know you mentioned in the previous hour that you're not happy when you have to go on strike and then see a patient die. But patients do die.
Yeah.
Where are we on that? Is it really necessary to let people die? Is it possible to provide treatment, especially the critical one? Watu wengine wa homa mnaweza deal nao tofauti. Mtu amekuja hapo akona shida ya tumbo, hiyo tunaweza. But when this patient is in critical condition, because we've seen pregnant mothers die with their children in their bellies before they deliver because wamefika pale hospitali and there's no one to assist. So how do we deal with those situations? Yes, we understand your plight, we understand your fight, but now also Wakenya wanakufa.
Let me say that it's only a very, very difficult decision to make. To go on strike or to go on a go slow or to withdraw services. But what do you do to an employer that you write letters and they don't respond? What do you do to an employer that you write agreements and they don't honor? What do you do to an employer that you issue threats and they don't flinch? A strike is not a breakdown in negotiations or conversations. A strike is the only thing that workers have to compel the employer to sit down. Actually, a strike is the beginning of meaningful negotiations or engagements. While an employer can withhold your salaries, transfer you, sack you, the only power that a worker has in this world is the power to withdraw their skills and labor so that they can be heard. We give notice. We give notice so that you can listen to us before we start it. We gave a 14-day countdown that elapsed and we still start back. We have given again a warning. If they still won't do it, we have to go on strike. Why? because 8 years ago we had a CBA which we agreed on certain things, issues around medical covers for our members, issues around paying them better on the basic salary arrears, yeah, issue around training more people so they can treat Kenyans, issue around having safe working spaces, issue around intercounty transfers and all that. And government agreed to handle all these things. They even agreed to pay us, make the changes on the basic salary slip. They never effected anything until last year when we did our 56-day strike, when the president agreed, they ordered 7 billion. They gave us the first batch of the 1.75 billion. The next one was to come in July this year. Haijakuja. They were supposed to effect the changes on the basic salary for them to stop accruing more arrears. Governors wamesema they have the money to pay. They only need a code from IPPD, that is the Public Service Ministry, the system that is used to pay, because people are paying from one formula that you just load. So they need a code for these new changes. Somebody just refuses to give the codes, say that it's sheni mkutano kwanza. Yeah, there's money that was.
Who is this someone who's refusing the code?
IPPD manager alisema kwamba before he gives that code to the counties.
Oh, jamani Mkenya.
You know, so so do you want me to be able to push for that meeting? You are the government. Wake up and do the meeting. This is an agreement that we agreed and even won in court. Why do you have to fight over it?
A code is like it's a password, for example.
Yes. Governors wanasema we have the money, we just don't have the formula. Because government money, you don't just pay. That will be a code that you use to load it on the system. So they give us the code, we load this thing. Nobody's doing that. They had agreed to promote doctors by September last year. They have not promoted anybody. That's why Kiambu has 3 days of strike because of promotion issue. They agreed on medical covers. Right now, most doctors don't have medical covers. So which other option, which other way, what else do you want us? We did a strike, agreed. The last...
You know, the reason I'm asking this, Doc, is because I lost my brother last year, but not due to a strike. It was just one of those unfortunate things. But I remember we took him to the hospital, and he died while undergoing treatment. And I'm just thinking, had I gone to the hospital that day and found a strike, it was a private hospital, but I'm assuming because there are Kenyans who cannot afford to go to where I took my brother. So if I were to go to a public institution and then I find an ongoing strike and then my brother still ends up dead, I wouldn't even be blaming the situation
illness
that killed him. I think I'll be blaming you for not being there to save him.
Can you imagine the pain of arriving in that hospital with somebody who is sick, who is dying, or that pregnant mother? Then you find it closed, or there's no doctor. Then you're stuck in this village, where then the next thing you have to look for a way of getting to the, you don't know where. It's a terrible thing Kenyans have to endure. And that's why ILO says clearly that for essential workers, anything you agree with them, implement it to full. And then when there is any complaint, address it early enough. That is what people who know what they are doing should be doing. But in Kenya, people wake up in the morning saying they're going to government offices, they're government employees, but they're not solving Kenya's problem. They are solving their own economic problems. How to make deals and do this tender and do this. People never think about how to solve. Otherwise, if people wake up to serve Kenyans, they'll be like, there's this agreement with KMPDU. Tumefika wapi na hiyo? Kuna hii agreement with na nurses. Imefika wapi na hiyo? Juzi you saw the UHC stuff. They were told they're going to be put on PNP. They stopped matching. They now want to start matching again. You get that? We must get to a point that every single day when you wake up to go serve Kenyans, your work as a government employee is to solve Kenya's problem, not to solve your own pocket problems. Yeah, KMPDU, we don't strike for fun, and I pray and hope that we don't have to get to a point that we have to strike over a strike. No, we striked over our CBA last year. Now we have to strike for the agreement last year for the other. It's annoying. It's being unfair to Kenyans, and I hope that the Minister for Health, Honourable Jalango, is fully aware of the complaints. We have written a letter to him, he has received it. We talked with him, and he has a very good open door policy for us. He's fully engaged on it. Mbadi, the treasury CS, is fully aware of the money that are owed to doctors. They should do what is right. The governors, they know they promised to promote by September last year. Just promote. They need to offer medical covers. SRC and PSC guidelines that tells you that in this job group you should get this kind of medical cover. It's all clear. The laws are there.
I want to play
People just don't do it.
Devil's advocate for a second here, whereby, of course, when you meet the government, they'll be like, hey, like, you know, say hakuna do. And then there's this other issue of the government you're negotiating with right now is not the same government you negotiated with in 8 years ago,
yes.
Because it has got different personalities in those particular offices. President Uhuru is not there, but he was the president 8 years ago. So now, how are you able to reconcile these two? Because President Ruto will or CS Duale will tell you, but now you see during your time muliongea sijui na Mutahi Kagwe. Sasa mimi hizi shida mnaniletea sasa surely wase. Mimi hata sielewi, hakuna do. I don't know what you guys, the formula that you guys came up with, because I'm even looking at the documents.
Yeah.
And I'm not understanding why he promised this, yet it is just impossible.
Because government exists in perpetuity. Government is government. The individuals might keep changing. Just say they walk and sit in that office. You don't say that me, I don't want to sit in Afia House, I want to go sit in Delta House. Because that's government. You inherit all the assets and liabilities. See that? Just say you inherit the taxes and you enjoy the taxes. Yep. You also have to inherit all the agreements. Thirdly, we have been told that Kenyan economy has grown. We're now number 6. So if the economy is growing, let it grow for everybody. It can't be that the economy is growing when we are doing all this other fancy stuff. But when it comes to now taking care of the workers, all of a sudden the economy is shrinking.
It grew for Unga alone.
You know, it's very funny. It's like having a parent or a dad. When we were young, grew up in villages, our parents are forever broke. There's no single day that my mom, I said that today I have money. Whether in the end month,
come and introduce you to my parents.
Yes, but the good thing about my parents, that when they say they are broke, we could see they were struggling. But it's one thing to see a parent who says they are broke, but they're having a sparking new shoe. They have just bought a brand new car. They're having a new suit. But when you ask for food, they're telling you, no, baby, I'm broke. If you're broke, let us all be broke in our way of life, all of us. And if we are thriving, let us all thrive. Because the sad thing, Kitambo, what I really feel sorry for the poor Kenyans is that Kitambo, if you wanted to buy tomatoes or unga cheaply, unaenda Kibera, unaenda kwa Mashimoni, things were cheaper.
Marikiti.
Yes, Marikiti, they're cheaper. Right now, tomato kama ni 10 bob, is 10 bob in Kilimani and in Kibera. It's the same price across. Unga kama ni 200 bob, it's in Lavington, the same within Madari. Hakuna Timalito, kama ni Akosiaga, kama ni 150 bob, Gorogoro. Ni kila mahali. So right now, everybody feels the same pain. There's no less pain for anybody and more pain for anybody. Njaa ya maskini na njaa ya tajiri ni same. Because of that, we must then all decide, if we are going to thrive as a country, we all thrive together. If you are going to suffer, you will suffer. But it is wrong to make the workers feel that there's no money. But every day you read the scandals. Which governor, EACC, which money was on Ghost, which one was going to take MCS to Zanzibar. There's money for everything except for serving Kenyans. And that's why we are saying no. Something must change.
Somebody said if you want to say that the economy has grown, we must feel it.
Yes.
Yeah, we must feel it. So kama tomato ni 10 bob across the country, then it means bado kuna shida.
Daktari ananuanga nyanya. Actually, nyanya ni 10 bob.
Yeah, it is 10 bob.
I'm a serious chef.
Good
so
stuff.
The question was on this revocation of the nurses.
Yes,
the
interns,
postings. Yes, the interns, because of the training, they had not completed their training. Okay, what is your stand on this?
The issue around internship was under the topic I talk about under training and production of healthcare workers.
Yes.
I told you that you cannot have universities and colleges producing nurses or not just healthcare workers. Nobody knows the numbers being produced, where they are being produced, how they are being produced, where they'll go after. They are producing, wamechukua school fees, wamewadump. Then they expect the unions to come start fighting. Of course, we'll fight for them. Government finds itself that it will budget for 2,000 nurses. The money they have can cater for 1,500 nurses. Then what happens? The same corrupt Kenyans, somewhere sitting somewhere, wherever they are, decides that if you give me something small, I'll put you in this list. Because you're all fighting to fit in this bus called internship. So in the long way, the poor people can't afford to pay this bribe, who are deserving, end up getting locked out. Those who graduated in 2019 missed out on this train. Others were put there and they were foreigners. Others were dead people who were put on that list because somebody dropped the ball. So Honourable Duale decides that let's fix this problem. But it fixes this problem through the normal route of justice of first in, first out. That those who finished first should come first. But the problem, in solving the problem, it creates another problem. Because it decides that which method can I use to shift through these 2,000 people? And I only have 500 slots. So it then brings a rule that let's give those who have graduated priority. A very fair thing by human being understanding. But the problem is that the internship policy is very clear. That notwithstanding graduation, you are eligible for internship. So while whatever is doing is perfect with the eye of natural justice, it then breaks the law. And this graduation is delayed not because of this poor student. It's delayed because the university delayed in graduating. I'll give an example of 15 dentists from Moi University. They were to sit their final exams. And Moi University, with the recent struggles you guys know, they don't have money to buy equipment and reagents for the final exam. So we had to contribute as doctors, as dentists in KDA, Kenya Dental Association, to buy these reagents for Moi University for these kids to finish their exams. But by the time they're doing the exams, they'd missed the train. So they've missed the posting. You see how incompetency ends up hurting innocent people. So some of these kids, the nurses, you're seeing them crying. They say that by law, first of all, by not graduating, I'm not locked out based on that. But more important, that even if it happened like that, it was never my problem. So how do we cure this? We have told Honourable Duale, call all trainers of healthcare workers in one room. Call all regulators in one room. Call Commission of University Education in one room and call the unions. Let us sit down. Let us agree that how many people are we going to be training per year on each cadre? Can the university support those slots? Because you can't have government giving Kenyatta University slots to train 40 doctors, but they admit 80 because the other extra 40 are paying parallel, so they're making money. So they're over admitting. And they have nowhere to go. So once we agree on the numbers coming in, then we agree that we'll be posting interns in July. So make sure that you graduate all your interns by December or by April. So they put a calendar that aligns with government. But you can't harakisha me to sit for exams, read overnight to pass exams, then you pack me for 1 year waiting for the next round of posting. You get that? That is the problem. Somebody somewhere just refused to do a basic common thing: leadership and governance.
Okay.
Where?
Yeah. Most of the time we go to the hospitals, we get operated, and sometimes you hear that this is an intern. Huyu hajamaliza kusoma, hajamaliza training. You know, people have had that misconception that ukitritiwa na intern.
No, let me tell you, interns are fully qualified. They pass all the exams. The only thing is that medicine is part science, part art. The science bit of it you learn in school. The art bit of it is you learn through mentorship and through doing. So whatever these interns come to do, that they come to work under supervision. You want to see, can you handle this emergency? Can you talk to patients well? Can you break a death news to the family? We check on so many things. Can you handle the pressure? Do you respect your colleagues? That's what internship is all about. But they are fully trained, and interns cover for 30% of workforce in this country. Interns cover for work worth 26 billion. If you are to look at the kind of work interns do, without interns, most of these hospitals will be closed. So they are qualified, and most important that they work under supervision. So even when they get themselves stuck, there's a medical officer or a nurse officer covering them, and above that, there's another consultant covering them.
All right, so Dr. We're almost getting to the end of the show, and actually we are at the end of the show. We have literally 40 seconds. What is your message to health stakeholders? This is a message, actually, I think a fellow doctor might be asking this one. What is the message you have to health stakeholders?
Yeah, there are two types of stakeholders. The first one is the Kenyan, and to tell Kenyans that keep the pressure. People are already feeling that healthcare is important to Kenyans. They can see the politicians are feeling that healthcare is an agenda.
Yes.
For the president to be talking about healthcare every single day, for him to put one of his most favorite and powerful ministers in Afya House, means that he knows that is a big agenda. So Kenyans put the pressure. Once you put enough, the politicians will know the value of healthcare. They'll know that they lose votes if they don't handle it. They'll sort it. To the leadership, the president and the minister and the governors, please let us feel the pain of the Kenyans. It's one thing to say those stories on media, on TV, on boardrooms. It's another thing for Kenyans to feel that change in their lives. And solve the Kenyans by helping the healthcare workers to be comfortable, by the drugs, by the hospitals, and let us finance healthcare. And finally, to the healthcare workers, when the government and Kenyans have supported us in every way they are trying to, let us tukule ile roho ya kusaidia Kenya. Imambo ya absenteeism, imambo ya stealing from the system, the imambo ya kukosa utu, malpractices. Let us also just give the best to the Kenyans the way they are also trying to give us our best. Otherwise, keep on praying for our country. We keep on asking that we have that conclave as KMPDU. That conclave must give us a referendum that must take part of healthcare back to national. Thank you.
Thank you so much, Daktari. That is none other than Dr. Dennis Miskellah. He is a Deputy Secretary General of KMPDU.